To look the situation squarely in the face, we must think about our own actions, our state's actions, and what's happening in this increasingly globalized world. Our lives have changed so much in the past year. What else can we do to stem the tide of this virus? What can we do to stop it? Do we know what we need to know? What do we not know? Tonight, we're going to talk with 4 speakers who are going to tell us about what's happening in our state and our region with COVID-19. Our speakers will update you on their efforts to stem that tide. They'll inform you of what you can do to help and what you need to know. Please listen. Please stay online. And please feel free to enter your questions into the chat. They will come directly to me. We already have about 20 questions submitted before the event, but we're going to get to as many as we can tonight. Thank you all for being here. It's my hope that we can work together to defeat this global and local foe. And now to introduce tonight's speakers, I'd like to introduce them in the order that they'll be speaking. And I also wanted to tell you that the event will end at about 7:45. Our first speaker this evening is Rick Lee. Rick Lee is a board member for the South Carolina Department of Health and Environmental Control. He's the 5th District Board member. He's a decades-old resident of Rock Hill, and he's also a Winthrop University grad. He earned his bachelor's degree in political science with a minor in history. Mr. Lee is also the chairman of the Governor's Nuclear Advisory Council. Mr. Lee served 4 terms on the York County Council and in positions on the York County Zoning Board of Appeals and the York County Planning Commission. He served as chairman of the North Carolina-South Carolina Bi-State Commission for the Catawba River and spearheaded local efforts in the U.S. Supreme Court to protect the Catawba River against encroachment. Mr. Lee is also chairman of the South Carolina Health Planning Committee, which establishes the growth plans for medical facilities in South Carolina. Mr. Lee was appointed by South Carolina Governor Henry McMaster to his board position, and his term expires on June 30th, 2021, which I imagine is not soon enough at this point. Our second speaker this evening is going to be Mayor John Geddes. Mayor Geddes is a graduate of Erskine College and earned his master's degree in public administration and a Juris Doctorate from the University of South Carolina. Following law school, Mayor Geddes began his private practice with the law firm of Harrelson, Hayes & Guyton, where he became a partner in the year 2000. In 2001, he became a founding partner of Morton & Geddes Law Firm. Mayor Geddes represented Ward 4 on the Rock Hill City Council and has participated in a number of nonprofit groups and community organizations, including but not limited to Early Learning Partnership, South Carolina Human Affairs Commission, Boy Scouts of America, and Rock Hill No Room for Racism, and many, many more. Thank you very much for being here tonight, Mayor Geddes. Our third speaker this evening will be Mr. Mark Nosaka. Mr. Nosaka is the Chief Executive Officer of Piedmont Medical Center in Rock Hill. Mr. Nosaka holds a Juris Doctorate from Tulane Law School, a bachelor's degree in liberal studies from Loyola University of the South, and an RN diploma from Charity Hospital School of Nursing in New Orleans. He was a practicing attorney for a number of years and worked as a registered nurse in the areas of trauma and intensive care. He also served in the U.S. Army Reserve Nursing Corps. Mr. Nosaka joined Piedmont Medical Center in 2017 after serving as the CEO of Good Samaritan Medical Center in West Palm Beach, Florida for 9 years. He's worked as a CEO in larger and smaller hospitals in several communities since 1996. And our final speaker this evening will be Dr. George Hind. Dr. Hind was appointed interim president of Winthrop University in January 2020. He earned his bachelor's and his master's degrees in psychology from Pepperdine University, a master's of educational administration from the University of Guam, and his doctorate in psychology from the University of Northern Colorado. Dr. Hind has had a distinguished administrative career in higher education, serving at several national and regional institutions, including University of Tennessee at Chattanooga, Oakland University in Michigan, College of Charleston, and many more. Dr. Hind was also a distinguished research professor at the University of Georgia. His work focused on clinical child neuropsychology, specifically in the genetic and neurobiological factors that influence fetal brain development in ways that put children at risk for later emergence of learning, behavioral, and psychiatric problems. Over his academic career, Dr. Hind has authored, co-authored, and edited over 100 book chapters and journal articles, as well as 11 books. So welcome to all four of our speakers this evening. I really appreciate that you're here. Each of our speakers is going to take 10 to 12 minutes to tell us about their area of expertise related to COVID-19 in our state. And then we will take questions after that period. So if you have questions, feel free to put them in the chat. And I'll hand the floor over to Mr. Lee first.
Thank you very much. Good evening to everybody. I'm glad to be among a large group of Winthrop students and faculty and staff. It's good to be at home. As was mentioned, I'm a board member of the DHEC, and our mission is to address the COVID crisis, which is truly an epic experience with regards to our prevention, testing, and treatment for the virus that has infected so many South Carolinians. The agency has about 3,500 people. We've hired another 600 or 700 that have come in as temps. And we have developed programs which touch all South Carolinians, all 5.1 million South Carolinians. To date, the COVID virus has taken 7,248 South Carolinians, and they're no longer with us. And we've had some 429,000 cases of the virus in South Carolina. What have we done during the last 12 months in the areas of prevention, testing, and vaccination? We've conducted, if you can believe this number, 5.5 million tests for the virus. You've probably seen the clinic that's over beside the Coliseum. We used to get nearly 1,000 people a day through that clinic. The numbers have fallen somewhat here recently, but we're still operating hundreds of sites around the state of South Carolina. We've had to contract with dozens of laboratories because processing so many samples exceeds the capacity of our agency. In addition, we've had to develop methods for tracking every sample and for putting personnel at every one of the sites, and then finding a way to notify people who had positive tests, followed by source tracking to see if we could determine who this individual may have also exposed during the previous 48 to 72 hours. So in addition to hundreds of sites, we've educated the entire state of South Carolina with regards to the practices necessary to restrict the growth of the virus. You know, last February and March, there wasn't a person on this call who had experience wearing a face mask, doing social distancing, washing your hands, or any of the long list of things that have come to be common practice for every one of us. Currently, the positivity rate for tests for the virus have fallen from over 20% on any given day to about 8.5%. And we're optimistic, though I'm not sure everybody understands exactly why the rate has fallen. We are optimistic that it will continue. We're proud of the fact that not a single resident in the state of South Carolina who's had this virus and has required a ventilator has been unable to get one. So we've been able to meet the needs, the medical needs, in partnership with our hospitals for every patient that's come to a hospital who required treatment. Currently, the numbers of personnel that are in hospitals receiving treatment for the virus, the numbers have gone down. We've put up a dashboard at the SCDHEC site, which any of you are welcome to go look at. And at that site, you're going to find there's a tremendous amount of information with regards to testing, as well as the vaccination program. So please avail yourself of that. It's quite informative, and we add new material and update it daily with regards to the numbers and performance of our agency. We've had so many press conferences, I'm not sure I could count them. The governor was involved in one every day for about 5 months. As I mentioned, new cases are down, as is the infection rate. New cases are down from 6,139 a day in this last January to most recently only 655 cases, new cases that were brought forward. We are tracking the variants. We did have a variant that came from South Africa that was detected in South Carolina recently. There is another variant that's coming out of UK that is in the United States, but to my knowledge, we haven't had it here in South Carolina. So we think, there's a lot of reasons for this decline. It could be that given the fact we've had so many millions of Americans, I think it's somewhere in the 25 million number. We've had so many Americans who've had the virus that we're developing a sort of herd immunity. The behavior of the public with regards to preventing the spread of the infection has improved significantly. The vaccination program has begun, we hope, to take effect and reduce the opportunity for the virus to spread. And there may be other reasons with which we're not familiar at this point that will reveal themselves as we come to understand the virus more. Presently in South Carolina, our vaccination program has sites in every county in South Carolina delivering vaccine to the public. We have more than 487 providers that have been accepted by DHEC as an official provider. And they include drugstores, hospitals, clinics, and you can imagine the full array of organizations. To date, we've received almost 1 million doses of vaccine. And presently, of that nearly 1 million, we're in the high 70% of vaccine that has gone into the arms of South Carolina residents. We have two kinds of vaccine. One is Pfizer, one is Moderna. The Pfizer vaccine is more difficult to handle because of the temperature requirements on it. So primarily hospitals and large clinics have been using this vaccine. The Moderna is used more commonly in drugstores and local clinics or senior care facilities. There are 4 phases of vaccination. There's phase 1A, 1B, 1C, and phase 2. In phase 1A, there's about 1,300,000 people that are included in this phase, and it's personnel and individuals who are over 65 or members of the medical community that have daily direct exposure to people who may have the virus. Phase 1B includes school teachers, manufacturing operations, key industries where personnel may be exposed to the virus in a disproportionate manner. Phase 1C is anybody who's 16 and older who has a serious medical condition. They qualify for this phase, as well as other essential industries. There's about 2.6 million people in that group. And then phase 2 is everybody else. So that's how the phases break out. You're required to register with VAMS, V-A-M-S, to get into the vaccination program, but there recently have been some changes that make it considerably easier to do than it was in the past. That was one of the biggest impediments that we had to success, particularly with seniors who are 65 and older, because in general, so many of them don't have email and don't use it. And so the VAMS system operated off of email, and therein lay the problem with regards to getting our seniors in and getting them vaccinated. There is a vaccine shortage. In South Carolina, we receive approximately 79,000 doses per week. We have 5.1 million people, and you can do the math to know that it's going to take a long time to get everybody vaccinated. But a year from now, we hope the landscape will be significantly different than it is currently. And if all of you and your friends and families will continue to participate in the use of personal protective equipment, PPE, and take the steps that the agency has been recommending, I'm confident, barring a variant which for some reason neutralizes the effectiveness of the vaccine, I'm confident that a year from now, we'll be walking around without these face masks on. So that's about the information that I have and on the status of what the agency's up to.
Thank you, Mr. Lee. Mayor Geddes?
Thank you, Katarina, and thank you, Rick, as always, for sort of laying the case out for where we are as a state and as a country, as a world even. You know, there's a lot to think about and a lot to work through these days. It's not a it's not an easy time. It's certainly not a time that I think anybody could honestly say saw coming in our lifetimes. But I think there's a couple points or a couple facts that we need to acknowledge right up front, and it helps sort of put a lot of this into context. The first one is the state of South Carolina, as Rick said, has approximately 5.1 million people. He also said that basically there's been about that many people in South Carolina who have had a test. Now, not everyone has had a test, but that's how many tests have been given. And in Rock Hill, we have a partnership between our local hospital, Piedmont Medical Center, and the city of Rock Hill that was put together in large part by Rick Lee and others, to where we're trying to figure out how we can get more shots in more arms of the people of our community. That clinic tomorrow will be open for its 15th day. It is open approximately 4 days a week, provided we have the vaccines. But because of issues with the federal government, we haven't been able to open up 4 days a week last week nor this week. But about 15 days tomorrow. And at the end of business today, we had put in 11,762 shots in arms in the Rock Hill Piedmont Medical Center Community Vaccination Clinic. Now, that's not all the shots that have gone in Rock Hill. Thanks to partnerships with other pharmacies and other organizations, federally qualified healthcare facilities, there have been other shots with the Moderna vaccine, as Rick mentioned. The hospital and the city are working with the Pfizer vaccine. So there are more people than just the ones we put shots in, that 11,762, but still not near enough. And as we all know, we're restricted to where we can only give shots to the first responders, doctors, and the others, and those over 65, which we're happy to be doing now. You know, I go out to the clinic just about every day and say a few words to our volunteers. And if you permit me, I'd like to say a little bit about what I say to them, to everyone on the call. And that is, just over a year ago, we first heard of something called the coronavirus. And we all made jokes about corona and a virus and how all of us had that at some point in our college years, I'm sure. And of course, we've realized since then that that's far more serious than the joke that we all thought it was a year ago. Actually, the first case was reported right at 1 year before we opened this Rock Hill Piedmont Medical Center clinic. So in a year's time, we went from a joke to something that our federal government saw as a real concern and was able to incentivize and pay to scale up the production of a new vaccine and to start getting it out into our communities. And that in of itself is really something that I think one day we'll realize how impressive that feat was. But putting that vaccine into people's arms is sort of like trying to build an airplane while you're flying. You're figuring out as you go. It's not easy. It's certainly not fun. And it causes a lot of people to bang their heads repeatedly against the desk or the wall as you're going through that. And I just have to take a quick second and thank Mark Nasaka, especially for his hard work and working with us at the city and putting our egos to the side and recognizing there's something much more important, and that is the health and well-being of our people and making things work. And it's just really been an inspiring story, one day that we can tell the right way, but right now it's just been one truly based upon some confidence, but more fear of what could happen if we didn't step up, we being the people of Rock Hill. And I mentioned that I go to the clinic about every morning and say a few words thanking our volunteers, and that's the message I try to pass along. We have approximately 600 people who have come in and given of their time to help put these shots in their arms. And if you can imagine, for those that are 65 years of age or older for the last year, they, like the rest of us, have been scared, anxious, worried to death about what the world was going to look like at some point in time, and just frustrated with our inability to solve these problems before us. And in talking to these volunteers every day, I remind them that these same people are going to come in the front door expecting things to go horribly wrong when they get here, that they'd be in a long line, that they'd be on their feet all day, that they'd have to worry about the after effects. But I can tell you, the people of Rock Hill, once again, have stepped up. And if you go through, or when you get to go through the clinic for your shot, when it's time, I think you'll be very impressed with the hard work that so many people do. Not only are they putting shots in arms, but we're putting confidence back in people's step and putting a lot of hope in people's hearts. It really is a wonderful thing to see after someone's gone through the clinic and gotten their shot, the relief and the joy and the hope that they have as they're walking out the door. You know, we've got a lot to be thankful for, a lot that we've come a long way, but we've got a lot more work to do. Of this 11,700 people that have been through the clinic, it's about half and half at 65 years of age. You know, early in the process, it was making sure we were giving the vaccines to our doctors, our dentists, our first responders, police officers, firefighters. And the average age of those folks is a lot younger than 65. But since DHEC's roles and we got into taking in people outside of that parameter and outside of the nursing homes at our clinic, we're seeing about a 50-50 split, which means we're doing really good at capturing more older people, because as the numbers go up, the percentage goes up. And it's likewise with our demographics of our community. Right now, as of the end of day Wednesday, it looked like we had about 16% of the shots given were given to non-white individuals. Now, we've still got a long way to go, but I can tell you 2 weeks ago, it was about 10%. So again, as numbers have increased, percentages have increased even more, which shows that we're overperforming, and the benefit of Zoom calls like this and all the things we're doing. We're on repeated calls with the NAACP, with our neighborhood associations, with our school districts, and with others, doing two things. Number one, making sure we're reaching out to those in our community that are able to get a shot at this time, but also with our school districts, trying to be a bit more proactive in helping them be prepared so that once they're allowed, or their eligibility is allowed to come through the clinic, we're ready for them. We didn't have that ability on any other group that we've gone before. And I think next week there's scheduled Zoom calls with our Winthrop friends, as well as Clinton College and York Technical School, to make sure that these schools as well are included and ready, so everyone knows how to properly register when it is time for each subgroup. We've got a long way to go. We're really pushing hard, and a huge percentage of those getting vaccines at this clinic are from the Rock Hill, York County area, but we do have people getting vaccines from as many as 170 zip codes. People coming from all around to the Rock Hill Piedmont Medical Center Community Vaccination Clinic, because it is open and it is putting through anywhere from 500 to 700 people a day, provided we have the vaccine. Thankfully, for Rick's hard work with DHEC and others, the registration process to become eligible for a shot is much easier than it was just 2 weeks ago, and is much better for all concerned now that it is easier. And that really takes, after getting the clinic open, after getting through the registration system, it really means that the only barrier to getting everybody vaccinated as quickly as possible is getting vaccines. And, you know, that's out of our control as a community to a large degree, but it is, I think, a testament to just how hard everyone's worked to be ready to get to this last step and really bump up those numbers, which, you know, we're told from the federal government they're coming, and we believe them. We just wish it was last week, not 2 weeks from now. So I look forward to answering any questions anybody has, but I do think the message from Rock Hill and our community is loud and clear, and that is that we're all in this together, that we have a lot of people beating the bushes trying to get those 65 and older into the clinic as quickly as possible. And everyone on this call can play a role in that regard. And I've got to say, there's a little self-interest there, because the sooner we can get through a higher percentage of those 65 and older, the sooner they'll unlock the other eligibility guidelines for others to get their shots. So please, when you talk to your parents or your grandparents, or when you talk to a neighbor, or if you're living off campus, someone you run into all around, encourage them to consider getting a shot if they haven't. And if they have trouble, or if they've had trouble registering, I believe Mrs. Moyan has a number she'll put up at the end or at some point, where just a telephone call to the city's clinic, the City Piedmont Medical Center clinic, and a call center we've got now going there to help people become eligible for shots once they meet the parameters. And then once eligibility is there, you don't have to go to the Rock Hill site. You can go to any site once eligible in the system and get your vaccine, whether it be a pharmacy, whether it be a grocery store or Sam's Club or whoever it may be. So I'll tell you, as mayor, I'm just, again, really proud of the people of Rock Hill. I've always said there's no group of people I would ever bet against like the people of the city of Rock Hill, who know how to stand up and look out for their own. So I thank you for the opportunity to speak and look forward to answering any questions.
Thank you very much, Mayor. I'm going to put the phone number that Mayor Geddes mentioned in the group chat. And now I would like to welcome Mark Nisaka.
Hey, good evening, everyone. Thank you, Katarina. And look, it's my pleasure to just talk for a few minutes, but to just kind of speak first to the Winthrop students who are listening. I'm curious what questions we're going to get at the end, but let me say this: we all in this country have been living through a pandemic that none of us had previously ever lived through. My great grandparents died, a couple of them in the Spanish flu in around 1911, I think it was. And since then, you know, this represents that next big event, you know, for the whole world that nobody's ever experienced before. And so, and what you're hearing tonight from Rick Lee and the mayor is about a community building a vaccine clinic and helping the community, but it didn't exist before. And so for those young people that are in school trying to figure out what you're going to do in your future, who aspire to leadership, you know, this is one of those events where leaders kind of get thrust into situations and you have an opportunity to help people that you never thought you'd have that opportunity before. And in that regard, it's been, you know, very rewarding to work with the people that we've been working with. Now, let me quickly go through some facts to try to add to what Rick and the mayor added. Look, a couple things about COVID, because I'm not sure where the questions are gonna come from, but you know, COVID is a virus like the flu, but the big things we learned about it is it creates a tremendous amount of clotting disorders in your body, blood vessels, microvascular blood clots, and your body gets all of these blood clots that affects your ability to breathe and do other things. And so all of the complications you hear about from you know, people who've been in the hospital, people who've gotten really sick, it's because they get a sort of a virus, a flu virus, but then your body goes haywire with these complications. And so for the first 7 days, people start to get symptoms, but after 7 through day 10, they get something, the ones who really get sick, get something called a cytokine storm, which is almost a type of autoimmune where the virus in your body is fighting against itself. And these people get really sick and it actually injures their body. It's not like a cold that you just get over. And so for lots of people and lots of young people, it's just a viral illness that you live through. But for others, their body really then reacts against itself and causes damage to itself because of this virus. And so for that small percentage of people, it becomes a life-threatening condition, as we all know. Now, we know lots more about it since a year ago. We know lots more about how to protect each other. We know lots more about PPE. We know lots more about giving different drugs like remdesivir and other things that might reduce symptoms. And so the treatment of COVID has advanced significantly over the course of a year, which is great for everyone. But just by background, anytime you have a significant event like a war or a space race in society where the government ends up having to invest in something, you have all of these discoveries. And we in the hospital and in medicine have learned lots of discoveries about how to treat this virus and how to treat people with it. And so we're encouraged by how far we've come as a society to treat people with the disease. Now, the biggest topic tonight is on the vaccine and what's going on there. And so just to add to what's been said, there's lots of statistics out there. Well, first, let me say this. The hospital was called upon to start giving the vaccine to workers in the community. But imagine this, everybody that works in a hospital is busy taking care of a patient. So how are we going to be able to treat people in the community with no extra workers? And so we reached out to community leaders, Rick Lee, the mayor, and others. And the mayor was the first one out of that group of about 35 people who said, look, the city will step up and help you guys. And little did we know that the mayor would organize, the facility over at the mall and all of the volunteers. And so it really has been a tremendous effort, but primarily by the work of the city and Jimmy Bagley in particular and others. So for the community, it's really been an outstanding effort to help each other. Now, a little bit about the vaccine. The hospitals get, as said, the Pfizer vaccine. There's others. We get the Pfizer because it has to be refrigerated, has to be controlled differently, and a hospital has those capabilities. Step back for a minute. It has been frustrating for everyone, this process of getting a vaccine, because there was no infrastructure. The only thing that happened was this country invented a vaccine in less than a year. Now I say only, that's what happened. Once it got, which is tremendous, but once it got invented, now all of a sudden we had to figure out how to administer it. And it's a complicated process. And so all of the frustrations that people have are because we're inventing a infrastructure to vaccinate people that requires a complicated process to do it. And so the good news, as has been said, in this community, we vaccinated over 11,000. I think the mayor said 11,700 people, which is just tremendous in such a short period of time. Now, let me give you a couple of facts about vaccinations, and in the interest of just educating people. The year before COVID hit, the country vaccinated for the flu about 175 million people, which is half of the country. 50%. Now that's a vaccine that can be stored, in any little refrigerator. It can sit out for a while. Everybody just lines up for it. There's no special requirements in terms of controlling it. And we're all used to getting it in a myriad of places. This is much more complex, much different than a flu vaccine. So we're trying, but yet the public, 50% gets the flu vaccine. We're trying to get the entire country vaccinated or immune to COVID for as much as 70%. So we have what they call herd immunity. So it's a daunting task for us, but it starts with community members and community partners like the city, DHEC, and Piedmont to get together to try to do this. There's so many scientific little details we could talk about, but I guess I want to try to figure out what's important to the people on the call. You give one vaccine, you wait 3 weeks, you give the second dosage. At the end of that, with the Pfizer vaccine, you wait another 3 weeks, and out of 100 people, 95 out of 100 people are immune from COVID at that point. We're trying, obviously, to vaccinate as many as we can. Nobody really knows what happens in the future. They're still trying to do research and figure this out. If you think back to 10 years ago when the N1H1 flu came out, and it was so life-threatening to so many people, and we all got very scared of it. Every year in the flu vaccine, we now have a portion of it includes the N1H1 vaccine mixed in with the other flu. I think what I'm hearing is that there will be a time when we all will have to have boosters and follow-up vaccinations in the future. My guess is it'll get included with the normal flu vaccines because we'll invent a way to make it convenient to do that. But we're still at that stage of just starting to vaccinate people for the first time right now. And And there's lots of statistics out there about states that are doing it better. And in South Carolina, there's a funny statistic that says we're ranked 20th out of 50 states in terms of we've only vaccinated, it says 80%. Well, to the college students out there, statistics can be twisted and turned, and it all depends on what factors you use to calculate the statistics. Here's what's important to know. We have given 111% of what we've vaccinated 111% of what we've been given, because even though the vial says 5 doses, we've been able to get 6 equally potent doses out of the vials. And so we've given 111%, which means we've given more vaccinations than what they thought they were given to us. So when you think about the 80% number or some fraction number in this community, thanks to the mayor and others, we've given all that they've given us and more. Now, statewide, that's not completely the same, but it's a testament to what we've done together in this community to do it better. Look, I'm in business. I'm a competitor. We're competing against other cities. We're competing against other states. We've competed very well to serve this community. And we've given every dosage and some to this community. So one thing we should do is say thanks to all the volunteers, the mayor and Rick, for enabling us to have that kind of success. Now, with that said, we want to do more. And right now, we're only getting maybe 1,500 doses this week. But we do know that Pfizer, Moderna, and the others are going to ramp up production. They're going to want to give more and more vaccines to the country. And so this process will expand over time. And we're asking everybody to be patient, because at first we thought we would just vaccinate a select group, people over 70. Now everybody wants it. So it's tough to think about how we're going to meet the needs of everyone. So what we do is we follow the state guidance. The state said we can vaccinate people who are over 70. Then they said we could vaccinate people over 65. We're doing that. So as the state relaxes the categories, if you will, or expands the categories, then we're going to expand who we're able to vaccinate, over time. So I'm going to stop there and look forward to any questions that people might have at the end. Thank you.
Thank you so much, Mr. Nosaka, for that information. There was a lot there, I think, that probably many people didn't know. So thank you for that. Dr. Hind?
Great, thank you very much. And I really appreciate being a part of this panel. And I especially appreciate the fact that we have so many students attending this panel, West Forum panel today. I think the thing that really strikes me is I arrived here at Winthrop University on March 2nd, a year ago. So I'm coming up with my 1-year anniversary. And I remember stepping into the president's office thinking, this is going to be a great experience. I had experience being a president before at another university. And within 10 days, I found myself making the most horrific decision to send all of our students home, send our faculty to work remote. And frankly, at that point in time, I was not sure we would ever be coming back full-time on campus. We went for quite a while where we were doing only remote work. But it looked like at one point in time, and I want to call out the students in particular and say thank you, because it was because the students at Winthrop University followed the guidelines that were set when we brought students back to campus of wearing masks, socially distancing, and engaging in good hygiene. And I'm amazed to say we made it through the spring semester. Summer went actually quite well. And this fall, I had every expectation that we could probably do it with students back on campus. Having said that, we've had some success. I think as all the students know that we were very concerned for our faculty and staff. We weren't sure about how the infection spread initially. And I think over time, we have learned a great deal. But before I go into some kind of details about what we've done, I want to kind of piggyback on some of the remarks that have been made by some of the panel members. York County, the city of Rock Hill, and Winthrop University really represent, I think, a model for how institutions can collaborate on something as incredible as a pandemic. For instance, when we were considering allowing students to come back on campus and wearing masks, we were absolutely delighted that the city of Rock Hill was requiring masks, because we then had a partner in the community so that students, as they walked across the street off campus, would still be required to wear masks. Mr. Lee has been an incredible partner. He has been an advocate for reaching out to Winthrop University so that we could deal with the COVID virus. Now, having said all of that, I think it's incumbent upon us here at the university, like everybody else, to kind of find our way forward on how we're going to deal with the virus, what we have done that is successful, and what we can do in the future that will continue along what I think is a relatively successful path. Our enrollments are down about 5%, not unexpected, but it actually looks like we're moving forward to attracting more students that want to come to campus. When you decided you were going to come back as a student to campus, it was very clear that it was going to be a different environment. And the fact of the matter is we have about 5,500 students here on campus taking classes either in person, in a hybrid setting, or remote. Having said all of that, we do require masks, social distancing, and good hygiene. The fact of the matter is that bodes well moving forward in the future. As more of our faculty and staff are vaccinated, and we're hopeful that we will very quickly get to the point where we can have vaccines available for everybody. I think we're going to be looking at a fall semester that is looking more like what you expected when you came to campus as a freshman, a sophomore, a junior, or even in your senior year here, where we would be able to congregate. We might not have to wear masks. That, I think, is still to be determined. But the fact of the matter is things are starting to look much brighter than they were looking in the fall. Having said all of that, we've learned some important lessons. One of the lessons we learned was we should be requiring proof of a negative test for students to check in and take in-person classes and move into our residence halls. We instituted that requirement this semester, and lo and behold, we found that where there were about 150 students that said they felt fine, but they came back and they tested positive. Those students we did not let check into the residence hall, and in many ways, I think we cut off the potential for a great deal of spread across campus. It was a rough go because many students, I think I'm going to cast some aspersions here, either didn't tell their parents that they needed to get a test or simply forgot. So we had a little bit of a rough time that first week of checking students into our residence halls, but we're now past that. And we have, I think, had very good control of the virus through our risk mitigation efforts. At any one time here on campus, we have less than 5 students in isolation. Now, some of the students that have tested positive have gone home to be with their parents as they go through the isolation phase. We, of course, have students on campus that are in quarantine, but we have been exquisitely lucky and fortunate that you, as the students, have paid attention to the guidance to mitigate the risk. Because, like I say, at any one time, we have a very low infection rate, positive infection rate on campus. And I think if you look at some of the other universities in this state, I would highlight Clemson University and a number of the other comprehensive universities, we have a relatively low infection rate. And I think that's because we have taken care to do the right things as we move forward. Now, having said all of that, attitudes have changed on campus. We surveyed our faculty and staff late in the fall semester. And at that point in time, only about 40%, maybe 45% of our faculty and staff said that they would definitely get vaccinated if a vaccine was available. We just redid that survey, and of the 600 people that responded to the survey, fully 91% of them indicated that they would get a vaccine if it was available. So we are working with certainly Mr. Lee, DHEC, and the city as we move forward to try and see how we can get certainly all of our faculty that are over 65 or have other health compromised conditions vaccinated. But we're looking forward to encouraging that as we start to think about how we might get everybody else on campus vaccinated. And that would be staff, faculty that don't currently qualify. Just so the students know, we have in fact applied to DHEC to be a point of distribution for the vaccine. But at this point in time, DHEC nor Winthrop are ready to pull that trigger. And I think there's quite a few factors at work there. One is the availability of the vaccine, and then the other is the availability of qualified personnel, even volunteers, to do vaccinations on campus. But that may be in our future, and we'll have to kind of monitor the situation as we move forward. As we move forward even further into summer, we will probably have a relatively normal summer school, pretty much like we had last summer, where many of our students were taking online courses. But we are looking to have what I would consider as near a normal fall semester as possible. Most likely still requiring masks, but on the other hand, I have the feeling that we'll probably be able to fill up our dormitories to their normal capacity because we are hopeful by that point in time, students, all of our faculty and staff will have had an opportunity to be vaccinated. But having said all of that, what you are observing here tonight is really representative of a community that has come together in a way that many communities across the United States have struggled. But here in York County, certainly in Rock Hill, and perhaps even in the counties that many of you have come from, South Carolina has done a good job trying to invent the way to deal with a pandemic that none of us have ever experienced before. In higher education, I think we have a very significant challenge because we are attracting young adults that as part of their education is learning how to socialize as adults with their colleagues here on campus. So it has been very difficult, I know, for you as students to really pay attention to masking, engaging in good hygiene, and not congregating. But you've done a marvelous job, and we're going to continue to move down the path to make sure that we can offer the classes that you want to move you toward your degree as most expeditiously as possible. So I'd be more than happy to answer some questions, and I would throw it back to you, Katrina, as the MC for us.
Thank you, Dr. Hind, and thanks to all of our speakers. I very much appreciate hearing what you had to say this evening. And I'm going to start with a question that builds on a theme I think that Dr. Hind really touched on here, which is the idea of community. I think as Americans and as Southerners, when we see things spiraling out of control and when we see people in difficult circumstances, we all want to roll up our sleeves and help out. And I can't find any more people to bake casseroles for. And I know that students in the dorm don't have ovens. So what can we as a community, as the Winthrop community, do to pull together to support those that are hurt by the pandemic? Are there any initiatives going on in the city, at the hospital, or at Winthrop itself, or somewhere else that I don't know about that you can tell us about where we can help others? And that's for anybody who wants to take it.
Sure, I'll give a quick answer. Number one, I think is what we desperately need more than anything else is go find people who are 65 years of age or older and have not gotten the vaccine and help them register and potentially get them to this clinic or any pharmacy that has openings. That's the one thing anyone can do. I failed to mention earlier, our Chamber of Commerce has stepped up in a very big way as well, and they're raising funds to help cover the cost of our volunteers, their meal and other expenses we have at the clinic that are soft expenses, so to speak, not necessary for the actual provision of the vaccine, but for the people that are there. So if any business or other organization that's listening in wanted to help, contacting the chamber, making a donation to their foundation for the Rock Hill Piedmont Medical Center Clinic, community clinic, would be great. But it really, I think the first and foremost thing everyone needs to do is find people and get them registered so we can put shots in their arms.
It's a interesting dilemma, because the people who need this the most are in fact 65 years of age or older. They're the ones who have the least access to internet, and the internet is a key feature in the process of getting registered, getting an appointment date, and tracking your records. The reason that we chose to start with an older population is because 75% or more of the fatalities occur in the age group of 65 on up. So that's where the real death curve, the mortality curve is for this virus. So if you have, most of you, I'm looking on the screen, most of you are young enough that your parents are not in that age bracket, but you may well have grandparents who are in that age bracket. And whether they live here or live someplace else in the United States, for you to help them to get registered, and which is one of the solutions we came up with when dealing with the folks here locally who could not register. If you can help them get an email address so that they can do the registration easily, you're doing a great service to your grandparents. And that once we get through that particular group, I would anticipate that these sorts of problems will disappear with a younger population. But for now, we've got 575,000 seniors in South Carolina that we need to get through the vaccination.
Let me just add to that on a slightly different note, and this is about mental health. If there may not be a job for someone to do, to go volunteer, to help with this effort, but there's still a job for people to do for their neighbors and their friends in terms of helping people to continue to cope with living through COVID. One of the terrible statistics about COVID is, while we were supposed to be socially isolated, traumas went up, abuses went up, suicides went up, drug and alcohol went up, and people who didn't have COVID hurt themselves because of just how hard it's been for people to live through this. So when you think about all the young people that are on this call, the hours of boredom being stuck inside, the hours of boredom of not participating in all the same sporting events and other activities that you were used to doing is mentally hard on each other. So watching out for your friends, watching out for symptoms of people in crisis is another good thing you can do to help us all get through this crisis together.
Yeah, the mayor mentioned that we have the hotline out there with the phone bank to take requests for assistance. And I've been out there working on this thing as well. And I have to tell you that for me as a volunteer, to receive a person on the phone who's 70 or 80 years old, and they start the conversation out by crying, and then you tell them that just chill out for just a minute and let's see what the problem is. And they finally relax, and then you tell them the process and you're going to help them get registered and so on and so forth. So they finish the conversation by crying because they're so happy that somebody helped them. Mm-hmm. So you just, it's quite rewarding, whether it's your grandparents or somebody else. So please step up to the plate if you can and give somebody a hand.
Now, if I could piggyback on that a little bit as well. Certainly we have our counseling staff here on campus, so that if you as an individual, or if somebody you know could profit from calling up our counseling center and talking to somebody, we would really encourage that, because it's so odd here. We're asking students to come to a university, to congregate, to make new friends, to talk to people that they otherwise may never talk to or have an opportunity to meet. And here we want you to socially distance. The incongruity in what we're asking you to do is rather profound, and certainly can affect, I think, everybody's mental health. Our faculty and our staff, I know, are feeling anxious, just like everybody else. and you may be. So please, if you or somebody you know needs to talk to somebody, please encourage them to call the counseling center, or if need be, take advantage of community resources as well, because this is the one time for sure that if there ever was a need to reach out, now is the time to do that. I would also like to say one other thing that I think is important and is a bit of an undercurrent of what we've experienced here on campus. Among some of our students, and I know even among our faculty and staff, there is a reluctance to think about getting vaccinated. There could be religious reasons or personal philosophical reasons, but I would encourage you, as part of your curriculum here, we are known as being a liberal arts and sciences university. And there is a great deal of science that has gone into developing these vaccines. And I would hope that you can have conversations with people that might be reluctant to take the vaccine or even get tested for that matter. Please talk to them about how the virus affects our body, how we can get vaccinated, how we can prevent the spread, and really prevent the spread for the health of the larger community in which we live. So please engage in those conversations with your fellow students, your friends, and really focus in on not only is the vaccine something we can do to help ourselves, but it's something we can do by getting vaccinated to help others as well. So please engage in those conversations. But above all, if you have any questions or concerns, please call our health clinic and talk to a counselor if you or somebody you know is feeling anxious, is depressed, not eating, not taking care of themselves. We have those services to your benefit. Take advantage of them.
Thank you. You all have touched on several of the questions that have been coming in. I wanted to ask another one because it's come in various forms this evening. And the question in a nutshell is, who decides priority groups? How are priority groups decided? The questions have come in related to age. They are related to professions, school teachers, line workers. They're related to medical conditions. What about people with pre-existing conditions? So I think that I might start by directing it to Rick Lee because I wanted to know anyway how South Carolina decides how the vaccines are distributed. If you could just walk us through that process. I know that it's not in anybody's
distributed
control.
or injected?
Who decides who gets the vaccine?
Oh, okay. So we generally try to follow the CDC guidelines. There's been emphasis on knocking down the mortality curve, which is the reason that we chose to pick seniors. Initially, it was those 70 and above, and it was expanded to include those who are 65 up to 70 as well. But we also decided that it was essential to protect the medical community who's charged with the mission of treating those who have fallen prey to the virus. So the first effort was those two groups, the seniors and the medical personnel. And that would be your doctors, your nurses, your anesthesiologists, the whole array of categories. Following that, the decision was the frontline essential workers. And these are the folks who keep the lights on, keep the roads running, manufacture food, those essential items necessary for our society to continue to function. And these folks are also at risk because of the nature of the environment in which they work, of being exposed to the virus in somewhat of a disproportionate manner. Following that, we went to personnel who have severe medical conditions, as I mentioned earlier, as well as the other essential industry personnel who have less of an opportunity of being exposed to the virus from their work environment. So those are the categories. That's kind of the basic justification for it. We can't, as everybody here I think would agree, you can't shut the country down and have everybody go to their home and sit for 12 months. I'm not sure what would be left at the end of 12 months. But we can't also continue to allow people with high risk from contracting the virus to continue to die in a very disproportionate manner. So you weighed all this stuff on two hands, and this is how we settled out with this process.
It's, yeah, so thank you for that thoughtful answer. It's a really hard decision that people are having to make. The next series of questions probably is directed to John Geddes and Mark Nosaka, and they have more to do with the campus community itself. People want to know how the city and Piedmont plan to coordinate vaccination efforts for colleges and universities in the area, including Clinton Junior College and the community college and Winthrop. And they're wondering because the population of the college campuses is so highly dense. So those questions all stem from that.
Yeah, I think the first thing we need to start with, and it was mentioned earlier, is the type of vaccines that are out there. The hospital, like all hospitals in South Carolina, gets the Pfizer vaccine. The Pfizer vaccine is the one that has to be kept at really cold temperatures. And so hospitals have the freezers to keep those vaccines, whereas our clinics and pharmacies and other organizations that are giving out shots don't have that capability. So all we give at the Rock Hill Piedmont Medical Center Community Vaccination Clinic is the Pfizer vaccine. So for any campus, whether it be professors or students, if they're interested in getting their vaccine shot when eligible, either now because of age or later when they open it up, if they're wanting to get that, either the Pfizer vaccine or get it with the Rock Hill involved, they'll have to come to the clinic. We're not going off site. It's just, I cannot express just how difficult this has been to get it set up. And we're just not able to do that at another location. Now, the Moderna vaccine is easier to move around. That's why our pharmacies and others have those. So it's possible that Winthrop, as Dr. Hind or President Hind had mentioned, could partner themselves with DHEC directly and obtain the Moderna vaccine and have them on campus for their professors or students. And that certainly would work if that's the role Winthrop or Clinton or York Tech or Rock Hill School District for that matter wanted to go. But I could just tell you from experience, it is a logistical nightmare to make this work. The background work that has to go in, not just putting shots in arms, but everything that has to be there. Thankfully, Piedmont and the city have been really good partners in getting this done. And I would suggest that probably the best way for everybody to plan on it is to plan to come to the community vaccination clinic. Once we have the vaccines, we can do 1,000 to 1,200 shots a day. There's just no question about that. We're doing 700, I think, today, Mark, simply because we didn't have more to give. Thankfully, to the Warren Norman Development Company, we've got a shell of a building that we can continue to scale out. So as long as we have vaccines and people are eligible, we can take anybody and everybody. It's just a matter of the number of vaccines that we can get. But I'll throw it to Mark in that regard.
I don't have anything to add. That was good, Mayor.
Thank you for that. On a related note, Dr. Hind, someone wanted to know whether the university will assist students in getting the vaccines and when they have an option to get those vaccines. I guess it would potentially be a bus up to the clinic or something at this point is what we're talking about.
When we get to that point, we will definitely work with the city and the community to try and make sure that the students can get out there, whether it's by bus or potentially working with the city and DHEC to have a specific day where they can all come on one day, say a Saturday, just devoted to Winthrop staff or faculty or students. But as soon as as the vaccine becomes available at that level for students and faculty and staff that don't meet the current criteria, we will work to see if we can't figure out some way to get them there. I know, as Mr. Lee was saying, the transportation and access really are two keys here to getting people vaccinated. If you don't have an internet capability, it's hard to register. If you don't have a car, it's hard to get out to the Galleria to get your shot. So we're going to have to work on that to see how we can deal with those logistics. But we'll definitely try and figure out some way for that to happen.
Katerina, if I could jump in,
Yes.
you already have. Winthrop is a sponsor of the MyRide bus system, and there is a stop on the MyRide bus system at the front door of this vaccination clinic. So
That's
Winthrop's already ahead of the curve thanks to the leadership of your board of trustees and others. So it's transportation to it from the campus is not an issue.
Right.
Might take a little while, but it's not an issue.
Let me add to that because I was hoping the mayor was going to bring up those free bus rides and those electric buses that he's so proud of. But so that was a good plug. But he's correct. We've got a free bus service on those electric buses here in Rock Hill that the mayor was able to make happen. Now, but let me add to what's being said for people. As of right now, you have to have an email address to get registered in the system. So because for us to give someone a shot, we have to be able to document in the government system that we gave them the shot. So that's why the email process, which is so challenging, is required. But when it comes to that point in time where the government, South Carolina government says, hey, we can vaccinate the university, personnel and university students, the mayor organized a call just a week ago with all the superintendents of the schools, elementary and secondary schools, not universities, just a week or so ago. So, we would organize some kind of conference call with the leaders to begin the process of educating everybody how we could make that happen.
Mhm.
So I think the real key here is just getting the government to tell us that we can do it. What we have the capability, we need a vaccine, but then we'll reach out to you all and say, look, let's have some planning sessions. That way we can give everybody the right information. Now, one thing that we do that other people don't do is we only schedule appointments when we know we have the vaccine. If you hear about stories from other communities where they give people appointments 3 months from now, we're going to vaccinate you in April. Those are made up appointments and they have no idea if they're going to get the vaccine. What we do is we open appointments every day for tomorrow's availability. So once people are in the system and they know they're in the category, then every day you check at the website, you go into the VAMS and you check to say, okay, can I grab an appointment tomorrow to go get the vaccine? And so that way we're not frustrating people by making a bunch of appointments that we have no idea if we're going to be able to serve them. It's a little frustrating that you have to go in every day to grab that appointment, but we thought it would be better for us if we didn't mislead people and they had the assurity that if they got that appointment, they get the vaccine. The other thing we're doing that's different from other places is if we give you the first vaccine, we're going to schedule you and we're going to make sure we have the vaccine so you get the second one.
Mhm.
So everybody who gets the first one from us is given an appointment, told when to come back, and then we make sure we've allotted and we've gotten the product so we can give people their second shot. So everybody who's gotten the first has gotten their second, and that's another just testament to how well this group of people have worked together.
And it's just 1 or 2 points there with regards to the complexity of doing all this. There's so many decision makers in the pipeline of this vaccine in Washington, D.C. with Pfizer. When we have a snowstorm over in Kentucky, guess what happens to our supply of vaccine? All of a sudden, it's not available because they can't run the trucks. Or sometimes we'll have decisions made by people in Washington. Historically, we've been able to receive our vaccine on a Monday. So we run our clinics on Tuesday, Wednesday, Thursday, Friday, which is just fine, works fine for us. A decision was arbitrarily made by a person unknown to us who decided that, no, we're going to start delivering the vaccine on Wednesday. Well, that sounds simple, except for the fact that the vaccine only has a 5-day shelf life when we receive it.
Mhm.
So it means that when we get it on Wednesday, it's shipped on Wednesday, they only have 2 days for us to use it. That's Thursday and Friday, because Monday or the following Tuesday is outside of the window. So we've had to struggle with that and try to get change shipping schedules and adapt to it. But to date, we have wasted no vaccine In all these hundreds and hundreds of vials of vaccine, we haven't left a single drop. And we have gotten vaccine into an arm that where it needed to be in every one of the days that the mayor mentioned our vaccine clinic has been open. Other locations can't make that claim. We can, and we're proud of it.
And always will.
And certainly you have a lot to be proud of. I think that I read that the Rock Hill Clinic was the first of its kind in our state. And the work that you're doing is just amazing. And I hope that one day our Winthrop students and faculty and staff can all benefit from it too, and potentially even volunteer, which we know that you're always probably looking for volunteers in the future. So once information is available for that, for volunteering, please just share that with us and we'll share it with our students. We have lots of questions, but we're out of time. So I want to be respectful of our guest speakers for today and make sure that we thank all 4 of you for all of the wonderful information that you've provided to our students. I think we're all engaged and thoughtful and really focused on this conversation and appreciating you for coming to speak with us. If we can work together more in the future, we certainly want to do that. And we thank all 4 of you for all the time that you took tonight to speak to us. So thank you.
My pleasure.
All right.
And
Thank
students,
you for all your work.
thank you. Students, I'm going to put up your overhead for your cultural event credit. I don't want to forget that. And I'm also going to share on our Facebook website, and on our Facebook page, the information for the pamphlet that Mayor Geddes gave us with additional information on the COVID vaccine in South Carolina. Let me just pull this up. Chewing gum and walking is hard to do. Here you all are. And thanks to all the students who were able to get on this phone or on this Zoom call and listen to our speakers today. Give you all a minute. Thank you very much to the 4 of you. Dr. Hind, while we're all still on, there were several questions about commencement. If you want to tell the students whether or not you think it might occur this year. And
Sure.
what,
I definitely, yes, I'm still on. Yes, I'd be more than glad to say that tomorrow at the Board of Trustees, I'm going to give an update on a number of things that are happening on campus about COVID, about the budget. But one of the things I will mention is that we have a commencement committee that is currently working on, we hope, having an in-person live commencement ceremony for our spring graduates. We have around 700 students that are going to be graduating. About 250 are going to be graduate students as well. So we are looking to have some form of an in-person live commencement, which will be different from December when it was completely virtual. So the details are still being worked out. We're not sure exactly where it will be, but we know how important that is for those students that are graduating. So thank you for asking that question.
thank you.
Sure.
Let's see if I can share this screen with you all. Dr. Hind, we also had a question, if students are still on here, about protocol enforcement on campus and how people enforce the protocols.
Enforce the protocols of mask wearing?
That's right.
Yes. We are in the process. We've noted a number of things, and none of this will surprise you. One is if I walk through the DeGiorgio Center and I see masks not being worn, invariably, as soon as they see me, those masks go up. And they may have been eating and just forgotten to put the mask up. So I think what we're doing is, and I know what we're doing, is that we have hired some safety ambassadors, some students that are going to help us by going around and reminding students to be wearing their masks and socially distanced when appropriate. So we're trying to make sure that the awareness of how important mask wearing is continues to be encouraged. We can't have either me or our Vice President for Student Affairs walking through reminding everybody. So we decided the best way to do this was to actually employ some student health ambassadors to go around and continue to remind students to be wearing their masks and engage in those kind of risk mitigation activities that we know have worked. So we're going to continue that effort. We want to make sure we do get to the end of the semester here on campus, safe with a very low infection rate.
Thank you. And thanks to all the audience for coming. Our event is finished for the evening, and we appreciate all of you attending. And I see that, that the mayor and that Mark had to scoot out right afterwards. I appreciate both Dr. Hind and Mr. Lee. I appreciate both of you for taking the time to speak at this event. You provided us with really a lot of information. So
It was very enjoyable. Thanks for the invite. If
And thank
you
you
need
for-
help in the future, please let me know. I'll be glad to help you.
Thank you
Thank
for
you.
organizing it. You did a great job, Katrina.
thank you. Thanks, everybody.
Bye-bye.
Bye-bye.